Hi, welcome back to the School of Social Work vlog series. My name is Amie Martin, and I am an intern with a perinatal mental health specialist in private practice. In my last vlog, I talked about my passion of supporting caregivers and infants in developing secure attachments through social activities such as dance and music. I truly believe in creating opportunities for families to receive support in a variety of ways, including social activities, wraparound services, and care coordination. Just seeing that that's so important to supporting moms during the prenatal and postpartum time. Many times there are other barriers to bonding, such as trauma, mental health, birth trauma, and substance abuse and addiction. With substance abuse use and addiction, that's something that has not only come up in my internship, but also as a GA for the ACPC I'm Vital grant. I've had the opportunity of researching and gaining more information about some of those barriers, specifically substance use or opioid use during the prenatal and postpartum period. Additionally, from research and from working with the professors and doctors looking at like a research standpoint and understanding kind of their what they're doing as far as their role in surveys and research and literacy reviews, and kind of how that plays a role in the treatment and policy recommendations, which has been really fascinating to learn about and see that process. Learning more about the current issues surrounding opioid use for women of childbearing age, looking at some of the solutions for treatment, how opioid use also affects infants. This is something that I was familiar with in child welfare services, but it's really looking at how they're going to treat it, looking at the problem, and then what they can do to address this opioid epidemic that we're having. So I've definitely gained a better understanding to kind of understanding more about the barriers to treatment for pregnant and postpartum women in Alabama and other states nearby, and looking at like the legal matters, the barriers to accessing, and then barriers to remaining in treatment. One of the treatment ways that they're looking at addressing opioid crisis is the medication-assisted treatment and pharmacist-administered medications. Those are some of the ways they're looking at addressing the opioid crisis right now. And through like a research review, literature review, I've also read that some states are focusing on that family-centered treatment approach, and that this looks much like the family decision or team decision meetings or wraparound services that we offered in child welfare services. And they're kind of looking at materials on how to approach this treatment and really recognizing a woman's role as a caregiver within the family, and how that should involve her children, her family, and the community in the process of treatment to kind of minimize some of those barriers of housing, transportation, employment, and addressing parenting education. And this is very similar to a residential treatment program I worked at in California. And so it's really fascinating to really see that research part of it, and the different ways that many different providers are having to address this issue from a different standpoint. In private therapy, making sure that their substance abuse is being addressed either prior to starting individual therapy, or making sure that they're in treatment so that they have effective therapy process, and then kind of understanding what to do from a therapy perspective about reporting substance use, and helping them make sure that they're in the right type of therapy or the right type of treatment. And then looking from a research perspective and a medical perspective, looking at how they're addressing this problem in our state right now. And so it's all been very fascinating. I've enjoyed learning more about it, and I look forward to sharing more about that with you in my vlog series. Thank you very much.